Good afternoon. My name is Latanya Smith, and I am the Family Caregiver Support Specialist for Piedmont Triad Regional Council. And this afternoon, I am going to go over the request for proposal for the Family Caregiver Support Program. And I want to say, we'll start off with, there has been updates to the proposal since last year. So just be mindful when you go onto the website that you do download the correct proposal form. The form will indicate at the bottom, FCSP RFP May 2023. So just be mindful when going on the website to download the RFP that you have the right one, because we will not be considering any other RFPs. This is the most updated RFP for state fiscal year 2024. So just be mindful of that. And when looking for the RFP, you want to go onto the Piedmont Triad Regional website, which is ptrc.org, and go down to the Aging Services tab. Once you click on that Aging Services tab, you will see on your left-hand side of the screen different tabs. You're going to look for your partner portal. Once you click on that partner portal, you're going to come down midway through the page, and you're going to look for the Family Caregiver Support Program area of the page. Once you see that area, you will be able to click on the very first tab, which is the Family Caregiver Support Program Request for Proposal 2024. So just be mindful that that's the only request proposal that we will be accepting. Anything that's outdated or did not come straight from the website will not be considered. Okay, so we're going to just jump right into it. There are several pages. I'm going to just kind of go through page by page. So if you have your request for proposal in front of you, I'm pretty much going to go down each page and just kind of address each page individually, each section individually. And we're going to start with page 1. I am showing my screen, so I'm hoping that the screen share is clear and everyone can see it and everyone can hear me. Page 1 is your organization checklist for Family Caregiver Support Request for Proposal. You're going to use the information on this checklist and the appendices A and B to complete the Family Caregiver Support Request for Proposal. Mail all the required documents, including this checklist, to the PTRC address below to my attention, and that is 1398 Carrollton Crossing Drive, Kernersville, North Carolina 27284. To my attention, Latanya Smith, PTRC AAA. So that is your address that all of the original documents should be coming to when you have completed the entire checklist. The checklist begins with the provider name and county, the amount that you're requesting, and just take careful consideration and be mindful of the amount that you're requesting. And just think back if you've had trouble in past years, especially with this past year, if you had trouble with getting money spent, or if you knew that you had to release a lot of money because you couldn't get the money spent by the end of the year, just kind of be mindful of that whenever you are making your plans for the amount that you're requesting to be allotted. Like I said, just be mindful of how things went within the past year or so, just to see if that's something that you want to look at in terms of making your request, out of the range of what you had done in the past. You're going to include in this checklist also a cover letter. The cover letter must include be included to state the request for the Family Caregiver Support Program Fund. So you have to have a cover letter and how you, the applicant, intends to implement the Family Caregiver Support Program. Okay. The RFP package checklist is as follows: request for proposal signature page. And this is to contain information about the agency which is applying for funding. Every RFP has a budget page that has to be initialized by the executive director. The family caregiver support narrative plan for service categories that will be explained, and you can see instructions for that in appendices A and B. Priority group methodology, also instructions for that will be included in appendix A. Family caregiver support budget form, submit pages 1 and 2 of the budget form. Again, there are 2 pages. It's not complete. If both pages are not completed and submitted, then your RFP is incomplete. And also, if you are using a subcontractor or purchase of service agreement, if you are using either of those types of services, then you will need to include copies of those contracts as well. There again, our community service organizations will complete an initial documents, including this checklist. Do not include appendices A and B when mailing the RFP. That would be pages 8 and 9. So you do not need to include in the RFP pages 8 and 9, which are your appendices. They're just for your information. Okay. We're going to go down to page 2. Page 2, Family Caregiver Support Program Request for Approval signature page. You're going to state the fiscal year for which you're applying, which would be fiscal year 2024, your organization's name, the address, the phone number, the name of your executive director, their email address, and that program lead and their email address if they are different or not the same as the executive director. And then we're going to go into your grant responsibilities of the funded agency. So as a funded agency, these are the expectations. The agency administers the family caregiver support programs using the family caregiver support funds allocated by the Piedmont Triad Regional Council Area Agency on Aging AAA. We have quarterly meetings. The agency collaborates with PTRC AAA and attends these regional family caregiver support program partners scheduled meetings, including conference calls and in-person meetings. The agency reports all partnership activities and recommendations to the county planning committee. So since I've been in this position, we've had one regional family caregiver support regional alliance is what we're calling it now meeting back in April. We will have another one coming up in July. I believe it's July 7th. It's on a Friday. That will be in person. The first one was a hybrid option, and we had several people that attended it via Zoom, and then I had several that came in person, but we are trying to do everything in person if possible. So my meeting for July 7th is not a hybrid option. It is in person only. Everyone should have received it, save the date calendar notification at this point. There will be an agenda coming out within the next several weeks and to just kind of specify all of the things that will be talked about and any speakers of that nature that we may have. Also, it is, the expectation that during the county planning committee meetings that someone from your agency or representative of your agency will attend the county planning committee meeting to update on the family caregiver support program and to just kind of give an update in terms of where you are with budgeting and spending. Also, programmatic and budget change requests are submitted in writing for review and approval with the PTRC AAA using the Family Caregiver Support Budget Revision Form, which shall be dated and signed. And also, again, be mindful at what time of the year that you're submitting revisions. You want to definitely keep up with the unit of service reports that come out monthly. That kind of gives you an idea of where you should be with your spending at that time within the fiscal year. That information comes from the ARMS report. So once the information is put into ARMS for the following month or for the prior month, you'll receive, or you won't receive, but the information will be on the actual website. So you want to keep up with the website. So each month, the ARMS information that's put into ARMS by you for the previous month is on the site, and it tells you at what percentage you should be with your spending for the fiscal year. You also, if you're attending those county planning committee meetings, you will have access to that information as well, because you're at that point, we are expecting, or the expectation is that you will be given some type of report with where you are with spending. So just know that when it comes to revisions, you want to do those sooner than later, but definitely keeping up with where you are with spending and keeping up the unit service report will help you know when and when to do the revisions and how to do those revisions, and kind of keeping in contact with us so that we can help you work through those concerns. The agency, which is you, maintains the required consumer contributions forms and documentations as specified in the Division of Aging and Adult Services Manual, Consumer Contributions Policy and Procedures dated February 2013. The agency Family Caregiver Support Coordinator attends any existing county Family Caregiver Support Program subcommittee meetings if they are having such meetings in your specific county. Specifications of funding. Every month, the agency will complete all the data entry into the ARMS system, keeping accurate financial and programmatic records, and will accommodate other requests by the PTRC AAA with, if someone calls you and needs any information to assist with getting that ARMS information updated or keeping it accurate, the expectation is that you will work closely with us to do that. Programmatic state mandated spending limits also should be adhered to. Spending limits per client will not be exceeded, just depending on the program. For example, the respite cap is $2,500. The North Carolina Family Caregiver Support Program logo will be placed on all literature and materials funded by the Family Caregiver Support Program in part or in whole. So that means any books or manuals that you will be distributing with any programs that you have. If you want to make sure you have some type of stamp or sticker to recognize the program, that includes any types of promotional giveaways as well. We just want the program to be recognized, and however you go about doing that is fine. You can, the logo is everywhere on our site, or, from information that we provide you with. So, but if you need any information or help with that, feel free to reach out to me. Please review the RFP instructions there again on appendices A and B. It will, those two appendices will give you more detailed information about how to complete certain areas of this RFP. And then there at the bottom, you have your signature and date, certifying that you comply with all the rules and regulations of the National Family Caregiver Support Program. There needs to be a signature and title and initials from that executive director there at the bottom of page 2, which is your first signature page. Or your signature page, but your first page where it needs to be initialed. Okay. Page number 3, we're going to get into service category narratives. Category 1 is planned for information and outreach about services, and that includes service codes 811, 812, and 814. And narrative form explain the strategy your agency intends to use to provide informational and educational programming in your county, and what is the plan to conduct the outreach. So you just pretty much want to describe in this area what you are doing and what you plan to do and how you plan to do it. You want to be really, really specific about how you're going to carry out getting this information out and making sure that you have a really good outreach program for doing so. Category 2 is plan for access to service, and that includes service codes 821, 822, 823, and 824. As a best practice, a contact log should be maintained by all family caregiver support partners, regardless of whether or not you are funding service code 822, which is information and assistance. So any kind of, you need to be able to be keeping records of any kind of caregiver related calls, emails, social media, any of that, any information of that nature needs to be kept somewhere in a log that includes contact information and the type of referral information that you gave out. And this just kind of helps us to know where you are as far as spending, and also lets the Division of Aging and Adult Services know how many people and how you are reaching people across the state and definitely within your area. You want to indicate the number of calls and clients that your agency anticipates serving for fiscal year 2024. So you have, service code 822, you have service code 823, which is the Caregiver Resource Consultation Code. This code has been changed from caregiver management and should be used to manage clients receiving service codes under service codes 4 and 5, which are your respite and your supplemental services, which are not long-term services. And then you have an initial area down here at the bottom of page 3 as well. Page 4, service code 824, develop caregiver emergency preparedness plan, just talks about strategizing with caregivers to plan long-term care, to help them strategizing planning for long-term care, helping them to identify backup supports and resources in the event of an acute accident or natural disaster. Okay. Category number 3, action plan for caregiver counseling, support groups, and training. Service codes include 831, 832, 833, and 835. The agency must provide a combination of support groups, evidence-based groups like your Powerful Tools for Caregivers, and/or educational classes such as the use of the True-Alta Caregiver Education Learning Platform. Provide your agency's plan to deliver a combination of these services in narrative form. Be sure to include the anticipated number of classes for evidence-based programs, education programs, and the type and frequency of these support groups. If service code 835, which is your caregiver training program, is used, one offering must include disease-specific education sessions. Evidence-based programs also include Powerful Tools for Caregiving, Building Better Caregivers, etc. Note that service code 835 is for series-based training sessions, and they have to include disease-specific education sessions. So you want to be very clear in how you're going to go about doing that in this narrative here in section category 3. Category number 4, plan for respite. Agency must provide at minimum one type of respite option from below. Category codes that will not be offered to caregivers should be left blank. Ensure all contracted agencies that will be providing respite services are listed in the services agencies column. Agencies providing respite must coordinate with Project Care and serve as a liaison for lifespan respite. In order to be eligible for respite care services through the Family Caregiver Support Program, the care recipient must meet the definition of frail as specified by the Older Americans Act, which also would include grandparents raising grandchildren. So to be eligible and to be following the standards, the care recipient must meet the definition of frail, and that also includes our Grandparents Raising Grandchildren program. So you have your different respite programs. You have 842, which is in-home respite, 843, which is community respite, 846, which is residential facility respite, 847, which is older relative caregivers day respite, and then down on page 5, you have your older relative caregivers hourly respite. And you see the hourly is attached to all of the service category for respite, and that's the way that it will be counted and added up. And when you put it in arms, it will be by the hour. These are hourly rates, or hourly units, I should say. Page 5. There's still talking about category 4 respite. Please document any respite policies that your agency may have, including internal respite caps or one-time respite for caregivers. It is recommended that all vouchers have an expiration date of 60 days or less. You don't want to get to the end of the fiscal year and you have people holding on to respite vouchers that they haven't used, or we get to the end of the year and you can't staff it, and you've kind of wasted a voucher or not able to get reimbursed for those vouchers. So you want to be mindful when giving out the vouchers of how long those vouchers will be good for, and maybe indicating that as such to your caregivers when giving the vouchers out. Category 5 is planned for supplemental services. For this category, the care recipient, again, must meet the definition of frail as specified by the Older Americans Act, which includes grandparents raising grandchildren. In red, it says no more than 20% of the budget can be for supplemental services. As a best practice, agencies should provide at least one Category 5 service. Overall budget cannot exceed 20% for Category 5 services. Category codes that will not be offered to caregivers should be left blank. And here are your codes: 853, 854, assistive technology, 853, handyman yard work, 855, home modifications, 856, personal emergency response systems, and 857, incontinence supplies, 859, liquid nutritional supplements. I will say that for 856, personal emergency response systems, that will cover the initial installation of a system, but it should not cover the monthly maintenance fee for any system. Here's your initial here on page 5. Each page will have an initial after that signature page. Each page will have an initial up until your appendices. 860, temporary home delivered meals. 861 is legal assistance. 863, transportation, and these are still under Category 5. And in your narrative, you want to explain how your agency will ensure all of your family caregiver support clients will receive temporary funding assistance, and that the funds will not duplicate or supplant any other existing services. You want to be really, really specific and clear about that in your narrative. Okay. And we're on page 6 now. We're getting into priority methodology to address the service needs. Reference the Family Caregiver Support Manual, Program Manual, that was effective July 1st, 2021. Section 5, Service Provision B, Priority Populations and Targeting Outreach. Describe how the needs of the most economically and socially needed, with attention to low-income, minority individuals, according to the Older Americans Act of 2020, how they will be prioritized in the delivery of these services. Okay, include methodology to address meeting the service needs of each of the following service priority groups: those with income at or below the federal poverty line, individuals with physical and mental disabilities, the socially isolated, individuals who are historically underrepresented, rural elders and their caregivers, and the frail and elderly and their caregivers. So you want to review pages 8 and 9 of your family caregiver support manual. That's where you will find specifics under the service provisions before completing the section. So before you get into completing this section, go back into your family caregiver support manual, pages 8 and 9 under the service provisions, and it will give you all of the specific information that you want to make sure that you include in this particular area. Okay. Page 7 is the first page of Appendix A, and this covers your additional instructions, shows you about each area with your additional instructions. Priority group methodology, which we just spoke of, includes, and you want to include strategies used to identify the target populations and the actions to be taken in the delivery of the services to these populations. Narrative must also address eligibility criteria listed in the section, as well as to address one or more of the priority groups below. And those groups include caregivers caring for older adults age 60 and above with neurological and organic brain dysfunctions, as well as Alzheimer's disease and related disorders. Caregivers of an adult with any age with severe disabilities, older caregivers 60 and above with great social and economic need, with particular attention to low-income, minority, rural, and those that have that are limited in English proficiency. Another group would be relative caregivers that are 55 and older, caring for children with severe disabilities, and grandparents or relatives ages 55 and older, caring for a grandchild or a child of a relative by blood, marriage, or adoption. And that includes our grandparents raising grandchildren of children under 18 years of age. So, you want to be really specific in your narrative and how you're going to address meeting the needs of this particular population. Eligible program participants. The following specific populations of family caregivers are eligible to receive services: adult family members or other informal or unpaid caregivers age 18 and older, providing care to individuals 60 years of age and older. Adult family members or other informal and unpaid caregivers age 18 and older, providing care to individuals of any age with Alzheimer's disease or related dementia. Grandparents and other relatives, not a parent, 55 years of age or older, providing care to children ages 18 and under, and older relatives, including parents 55 or older, providing care to adults age 19 to 59 with a disability. And also, eligible participants, in addition to receiving the eligibility requirements above, the Older Americans Act specifies that the caregiver receiving Category 4 or Supplemental Services Category 5 must be providing care to a care recipient who meets the definition of frail. This also includes our grandparents raising grandchildren. Frail means that the individual is determined to be functionally impaired because he or she is either unable to perform at least two activities of daily living without substantial human assistance, including verbal reminding, physical cueing or supervision, or due to a cognitive or other mental impairment, requires substantial supervision because the individual behaves in a manner that poses a serious health or safety hazard to the individual or to another individual. Okay, and then there's an initial page there. Page 8. Appendices, page 2, part of Appendices A. Budget requirements. Please submit any family caregiver program budget forms, pages 1 and 2. So remember, there's 2 pages for the budget form. Those pages are found on the partner portal under the Family Caregiver Support Program area on the page. So it would be listed under the RFP. There is a link that will open up those budget forms for you. They're 2 pages. So be sure to remember that there's supposed to be 2, because if you only submit 1, it's incomplete and it is not valid. So you have to have both pages completed. Budget requirements: no more than 20% of the applicant's family caregiver support budget can be allocated for category 5, which is your supplemental services, unless written approval is obtained from PTRC AAA. 4 family caregiver support program service categories that should be provided are information, which is your category 1. Assistance with access is category 2. Caregiver, counseling, support groups and training is category 3. And respite care is category 4. They should be provided in each county. Now, for fiscal year 2024, this is a recommendation, but this will become a requirement in state fiscal year 2025. There again, for state fiscal year 2024, this is a recommendation that these 4 categories are represented in each county, but this will be a requirement in state fiscal year 2025. Respite cap of $2,500 per client per instruction in the administrative letter number administrative letter 12-7, and this includes project care. So you be mindful of that cap when doing respite, if you're providing respite or whatever type of respite programs you're providing. Be mindful that this is in conjunction with project care. Please include on your budget forms the staff name, position, and any benefit expenses, which would be FICA, insurance, retirement, using staff lines, and note that whether or not they're part-time or full-time on that budget form as well. Unit rates are needed for unit-based services. Please indicate the number of clients estimated to be served. Please note, without a unit rate or client numbers, the family caregiver support budget cannot be processed. I will repeat, without a unit rate or client numbers, the family caregiver support budget cannot be processed. If outside agencies are used and listed on pages 4 and 5 of the RFP, either as a subcontractor or a purchase of service, please include the name and descriptions on the Family Caregiver Support Program budget forms. If using either a subcontractor or a purchase of service agency, please send a copy of the contract or purchase of service agreement with the submitted RFP, along with a copy of the agency's current in-home aid license. This is very, very important, and it's important that it's all together whenever that RFP is submitted. And page 9, I will say that again, you do not need to submit the appendices. It does show initials, but you do not need to submit the pages of the appendices. Certainly keep those for your records. Page 9 is Appendix B, and it's certainly self-explanatory. It gives you all of your categories 1 through 5 and the different service codes that are related to each of the categories. Okay. Also, there is an attestation form that needs to be downloaded and completed as well. That attestation form is just as a reminder, just to, not a reminder, but it is needed to be completed and turned in as well, just to indicate that you did see the video, that you did watch the video, and that you are aware of everything in the RFP, and just to know that I'm here for support if you need anything. So if you've looked at the video, then you know that there's an attestation form that needs to be completed and downloaded and completed and sent in as well, so that we know that you've seen this part in terms of explaining the RFP and what needs to be completed, and the important pieces to not to forget about. And clearly, it shows that everything needs to be completed, and special focus needs to be on certain areas. So please, the attestation form will be under the Family Caregiver Support Program area on the website as well, under the partner portal. Download that after you have watched the video, that you've seen it, and return that per the instructions on the attestation form. I think we're here at the end. Just want to let you know that I am here to answer any questions. I'm here throughout for those that, get your proposals in and get awarded. And we're working together again this year. I'm here for technical assistance. If you have any questions, reach out to me. I will try to get those questions addressed and answered as quickly as possible. Also, again, the expectation is that you will be able to attend, or have a representative to attend, our regional quarterly providers meetings that I will be hosting quarterly. Our next meeting will be in July. It will be July 7th. That is on a Friday from 9 a.m. to 11. Hopefully everyone has received a calendar invite, and the agenda will be coming out within the next couple weeks. If anyone, again, after watching the video, has any questions or needs any assistance with anything, please feel free to reach out to me, and I will try to get all of your questions addressed and answered in a timely manner. And again, I hope to be speaking with you soon, and working with those that I've worked with over the past been here 5 months. So over the past 5 months, I've thoroughly enjoyed working with the partners that I've worked with thus far, and look forward to working with any new partners that will be coming on board this next fiscal year. There again, my information is on the RFP. I can be reached at area code 336-904-0300, extension 2021. And my email address is lsmith@ptrc.org. Thank you. Have a good afternoon, and talk to you soon.